So you want smaller nostrils. You want a narrower, lower third of your nose. But the real question is your nose too wide or are your nostrils too big? This is a very important question and will guide your surgeon's decision making for a corrective surgery. Stay tuned to find out more. Hi, I'm Dr. Jonathan Zelkin, board-certified plastic surgeon in Newport Beach, California. Here today to talk about a very popular procedure that can often be done in the office setting called Nostril Reduction or Alar Flaring Reduction or Alar Width Reduction. There's so many different types of reduction surgery related to one's nostrils, but there's a lot of nuances, and for you to really understand what you want corrected and to convey this to your surgeon is mission critical. So here I am today to educate you guys about the difference between alar flaring and alar width. Before I begin, I want to discuss these two different distinct phenomena. One is increased nasal alar width, and that's basically the foot plates of your nose, the crease along the side of your nostril. If it's too wide and it extends far beyond the medial canthi or the inner corners of your eyes, then you have increased nasal alar width, and that can be in conjunction with a fatter or thicker nostril, or it could be in conjunction with a very thin nostril, as I've presented in previous videos. When it is in conjunction with a thin nostril, the corrective strategy does not address the nostril itself, but the base or sill of the nose. And we perform a procedure called sill reduction to narrow the aperture or the nostril width directly. That can be a fairly scarless technique. Any scars that are placed inside the nostril are generally unfavorable, but they can be hidden pretty well and are generally well tolerated. In contrast, what I've shown in previous videos and I'll show again today is a more common finding where the width of the nose is actually okay. It's within normal parameters, but the width of the nostril itself is a little bit excessive, and we call this alar flaring or excessive alar flare, and that's when the base of the nostrils is actually in an okay position, but the nostril itself is really thick. The nostril at this position can be thought of as a sandwich where you've got the skin and you've got this really thick sort of fibrous tissue as a filling, and then you've got the nostril or vestibular skin on the inside. When that is too thick, we simply reduce it, and depending on the configuration and your desires, we'll shape that excision pattern a little bit differently in different patients. Typically, you can think of it as sort of a crescent moon in most of my patients that goes along the crease and inside the base of the nose. So you get some degree of width reduction of the columnar cell as well. Today we're going to be discussing a beautiful young woman who has a very ethnic Brazilian nose. And this nose, even though it's attractive, in my opinion, could use a little bit of refinement in the tip as well as some dorsal projection and definition. However, these features did not occupy this patient. They didn't bother her. And because of that, I think the best corrective strategy is the most minimally invasive, and that's usually how I approach a lot of facial issues. And so alar reduction itself, called a weir excision, was chosen for this patient. And again, this is a three-dimensional strategy where it's not just a wedge of skin on the outside, but it also does extend internally into the nostril itself. Check it out. So as you can see here, through a very well conspicuous result, and I'll tell you, this is still an early post-operative photo, so the scar is still actually a little bit red and raised, and this will continue to mature with time, but even in this patient you can see already a fairly inconspicuous scar and a vast improvement on what we call the worm's eye view, meaning that when she looks up, the nose is not too wide anymore all of a sudden. And that's not because I narrowed the nostrils. I didn't use an alar cinch suture as we've talked about in other procedures. I didn't do any sill excision directly. However, the three-dimensional reduction of the nostril from the outside to the inside did allow me to take advantage of the fact that the base or foot plate of her nose was actually adequate and that she simply had excess skin, fibrocartilaginous tissue, and nostril skin, and that was excised directly, enclosed in layers, and a minimally invasive, minimally traumatic technique. As the scar continues to mature, it becomes even more inconspicuous, and to speed things up, we do things like steroid injection in the meantime to make the scars even more inconspicuous. If this is something you want, this is something you should definitely present to your plastic surgeon, and if he or she doesn't feel comfortable discussing or understanding the nuances of distinguishing excessive alar width versus nasal alar flare, then maybe you should find another plastic surgeon. I'm very happy to discuss. This is one of my favorite procedures and tends to generate very high levels of patient satisfaction. It's also incredibly gratifying and has a low complication profile. The entire procedure takes less than an hour in most cases and is relatively bloodless and pain-free. Thank you so much for taking the time to watch this video. If you have any questions or concerns, please comment below. Be sure to subscribe, and if you haven't already, hit that notifications button.